introducing myself, and then if it's okay, if we'll just go around the room and everyone will say who they are, and I will try and remember who you are, or people don't know who they are. So my name is Heather Brown. I'm Professor of Health Inequalities at Lancaster University. I am also the academic lead for the HCRC in Blackpool, and I'm part of Health Determinant Research Collaboration, and I'm also part of a project, which is why I'm here, that's funded by the Arts and Humanities Research Council, looking at how different areas can use their kind of local organizations, such as charities, to support tackling health inequalities. So, and today we're going to be talking about health economics. I have loads of slides, because it is not, Sam kind of alluded to that earlier, it's quite a complicated thing. So at the end of this, don't feel like, yeah, it more shows you how to do it and some things to think about. But by the end, you will not be able to do economic migration. But hopefully you'll have a better understanding of what it is to think about how you might want to, I guess, to target future learning and to think about kind of starting to collect data to be able to do one. So we'll talk about how you kind of go through the steps of doing it. But we need a lot more than 2 hours to actually be able to do one. So, yeah, okay, so I'll just start with you. Okay, so at any point you don't understand anything, just stop me, because most of my teaching on health economics has been for postgrad. In fact, I haven't taught undergrad in 15 years, so most of this is for postgrad, so it is, you know, at a slightly higher level. I have tried to kind of make it accessible, but I'm pretty sure that there are bits which, unless you're a health economist, might not make sense.
Could I just ask Heather, because it'll just influence like how many notes I take and stuff, are you happy to share the slides and stuff at the end of the presentation?
So I think I should have everyone who signed up emails, so I can email you everything at the end.
Perfect.
And also, we are recording this session, not you, not your faces, only Heather and the slides. So, are you okay with that? Yeah. And we will share the recording with you beforehand, before publishing it on our website, just to get your consent again, if you are happy with it, or if you want bits that you share, for instance, in this session that you want to be removed, etc. That will be possible as well. Thank you.
Okay, so I was just going to start with a quick definition. So many people, when they think of economics, they kind of just think about money. But health economics is much wider than that. So it's considered the study of scarcity, and by scarcity it means that there's only a certain amount of resources, and we have to decide how we spend those resources. So that's kind of what health economics is interested in, is how we distribute a limited amount of funds to various programs. And it's kind of creating a framework so you can look at how you make those choices and what those choices mean. Okay, so what then do health economists do? So basically, rather than just saying, you know, this will save you money, it's kind of wider than that. So it's looking at, basically they inform decision makers so that the choices they make maximize health. And health can be a lot of different things, so it doesn't have to necessarily be physical health, it can be mental health, so of the population. And it can also even be around quality of health, so it doesn't even have to be, you know, extending life years. And it's the same thing, that it's not necessarily concerned with saving money, but improving the level and distribution of population level health with the resources that are available. Okay, so that then takes us to this. So how do we decide how resources should be allocated? And I briefly mentioned it. So do we look at quality of life, life years, or something else? And that's when kind of a lot of work around health economists look at population preferences, and that's kind of how that's decided. So in the UK, nationally, that's done through a body called NICE, which is the National Institute of Clinical Care and Excellence. So they do surveys of different parts of the UK population to determine what people value, and then that filters in through their decision making. Okay. second, so if there is clear societal steers over what people value, the fact that there's a lot of different things we can do means that not all of them can be funded. So you have to think that even within different programs which are seen as valuable, how you decide which one should be funded using some methodology which we'll describe in more detail. Oops. And that's where we come to this idea of choice and comparisons. So even kind of at individual level, we're doing these, making these choices kind of without even really thinking about them. So it's how you spend your money, how you earn your money, and how you spend your free time, or choices that you make, which kind of, economists at least would say that there's some economic kind of rationale behind how those decisions are made based upon how you value the different activities. And the other thing is that we have finite income, so we can't do everything we want. So that's why there's these choices behind then what we do decide to do. Okay, so then this is just some very basic examples thinking about kind of from a healthcare perspective. So the idea, I guess I'll take, this is on the slide, but I'll use some of the things that we talked about. So thinking about kind of the centre that you fund, or some of, programs for 0 to 11 sports. So say you had a limited budget, you have to decide, because both of those have value to the community, but thinking about kind of which one would be allocated funding. So that would be something where you could look at, use some health economic principles to decide which one to invest additional resources in. So this one is more, I guess, specific around prevention versus treatment. So that's kind of another thing that comes up, is because obviously prevention saves costs down the line, but treatment saves costs in the closer to time. Okay. So when you make a choice, kind of in, I guess, health economics jargon language, the idea is if you decide to fund something, that's called priority setting, and then if you decide to not fund something, that's called rationing. So say, for example, if the local authority decides to give more money to your centre, that would be priority setting, kind of the work of the centre. We decided we wanted to look at kind of kids and gave money to that, then be kids, and the other one would be rationing, saying, well, we don't have the funds at this time to support that activity. Or I guess the same things like for Ukrainian refugees or LGBT plus, same idea. Okay. And then the other thing to keep in mind is that there's the understanding that, say, with all these programs, the idea that all of them have value, but that you can't fund them all. So it's saying that by funding one, then we're also not using resources in another beneficial way. So it's making kind of the case of saying why one thing is, I guess, potentially more efficient to meet societal goals, and that's kind of why you do health economic evaluation, and then you can make that case again to the community and to other kind of relevant stakeholders. And the idea that, especially, I guess, in the healthcare setting, that if you're treating one person, that means that you're not treating someone else at the same time. So the true cost of treating a patient is also the fact that you can't be seeing someone else. And so the same thing, I guess, with community programs, you could say the same way, that if one program is happening at a centre, it means another program is not happening at the same place at the same time. So, you're choosing to support, I guess, certain parts of the population and what that means. Okay, and then the other kind of really important thing to keep in mind, and this is if you were to ever do, and this is probably the most complicated bit really, and I'll go into it in more detail further on in the slides, is costs. So I guess most people think of kind of financial costs. So you have the cost of this mouse, cup of tea, but when you're doing an economic evaluation, the costs are a lot broader than that. So we have financial costs, so that everyone knows about, it's just buying things. But we also think of, in economic evaluation, the wider concept of how we're not spending money as well as how we're spending money, and costs to different kind of parts of society. So you could think of, I don't know, so say sports programs for kids who are 0 to 11, you have the direct benefits to the kids, but then there might be wider benefits. So say if they get engage in sports and they make friends, that means when they're slightly older they might be less likely to commit crimes, or so that those are the wider costs that need to also be considered. So you have costs of the criminal justice system, as well as kind of the costs of parents. So you say that if you have these activities after school, that parents might be able to work for an hour longer, so there's the cost associated with that, and all those need to be considered when doing an economic evaluation, which is why I said at the beginning that's very complicated to do. So it's just thinking, I guess, to start to think about what you need to collect and how it would need to look before you do an economic evaluation, and kind of thinking through the different kind of people involved and what that looks like. So that then brings us to how kind of that is framed. So it's an idea called opportunity costs. So it basically measures the cost of any choice. So what that means is, say, because I'm standing here now, so I'm not doing something else. I could be, sitting at home. I'd probably be working, so I'm doing some other work. And so there's the cost, kind of that's thinking about it, that whatever else you'd be doing at the moment. So you could think, as I said, with the programs, that, if something's happening, say, for Ukrainian refugees at a location, that means, there's not something for elderly people. That this program's happening at the same time, and the costs associated with that. And that relates to the idea that there's no such thing as a free lunch. So, less so I feel like now, but here you can say with this seminar that there's a lunch afterwards. But that's the price of staying for the lunch, is that you have to listen to 2 hours of people talking about health economics. So there is a cost associated with that. Okay. And that then is kind of an overview of the key concepts. Before we move on to the idea of economic evaluation, does anyone have any questions, or does that all make sense? Okay, good. So, what is economic evaluation? So the key thing, I think, to keep in mind, and as well as if you're planning out any sort of evaluation, is that you need to have a comparison. So at the very end, we're going to talk about a method where you don't necessarily need to have a comparison group, but you need to basically have baseline and treatment as usual, and then a new thing going on. So you have to be able to show a change, and that's really, really important if you're going to do an economic evaluation, because otherwise you can't. And so it's basically comparing these two things, so your standard treatment or standard program, which could be to do nothing, so the costs then are zero, to a new program. And then you look at both their costs and the outcomes of the people who participate. And it's concerned with efficiency as well as effectiveness. So effectiveness means just kind of how it changes people's outcomes. And efficiency means, does it do it in a way that doesn't cost loads and loads and loads of money compared to standard treatment. So both of those are really important, because you could have, I guess a lot of times, an example is when you have really intense interventions for kind of people with complex needs or families with complex needs, that those work. there's evidence that they clearly make a difference, but they're very, very, very expensive. And you'd have to think, when doing these things, that is the benefits to helping these small number of people outweigh, you know, the benefits of helping, say, a wider group of people with a less intense type of intervention. And then this is just basically why we do it, is, as I said, so we can say that we're spending resources in the most effective way. Okay, so there's 3 main types of economic valuation. As I said, at the end I'm going to talk about another type, which, and then there's actually 2 more types, so we'll talk about both of those as well. So the main ones are cost effectiveness, cost utility, and cost benefit. So the difference between all 3 is it depends on what you're trying to do, and it depends on what you're comparing. I'll go into more detail, but just briefly. So this one, you can only compare the same outcome across 2 different things. So this, with cost utility, it looks at, you can look at quality and quantity of life, so you can look at more things, so therefore you can compare across 2 different types of things. So they say a lot of this is with more healthcare, so when I think of it, I think, so if you wanted to compare, like cost utility, you could compare knee surgery treatments versus, you know, hip replacement, something that's quite different. Where with cost effectiveness, you could say compare different types of screening for cervical cancer. That is a bit more limited in what you can do. In cost benefit, you can compare completely different things because everything is put into monetary amounts. So you could look at, you know, a cycle pathway versus a program for LGBTQAI+.
There's every time I wake up in the morning, there's a new letter. So,
so that you could compare across quite different programs with cost-benefit analysis. And then the other types, which aren't on the slide, is there's another type which is commonly used for public health interventions, which is cost-consequence analysis. So that just, as well, that can be looked at across a wide type programs. So it just looks at all the costs that we've briefly talked about and just the outcomes, and it leaves it to the people making decisions to just look at those and see what they think. So it's kind of more just a spreadsheet of these are the costs and these are the outcomes. But you still have to do quite a lot of maths in between, which we'll briefly talk about. But and then there's also return on investment or social return on investment. Social return on investment is slightly different, and we'll get to that in the end. But that's the one where you don't need a comparison group. So for every other one but social return on investment, you need some sort of comparison group. Amelia?
Is there any that are more commonly used, or do you use them singly, or do you use both? Can you combine?
So you can combine. So they're used by different people. So the Treasury is a big fan of cost-benefit analysis. So stuff for the Treasury usually uses that. And as well in kind of things like environmental economics, they tend to use cost-benefit analysis. NICE, so for healthcare decision-making, tend to use cost-utility analysis because they, there's a measure quality-adjusted life years, and that's kind of how they make decisions, is based upon that. In public health, they tend to use cost-consequence analysis because because a lot of public health interventions, you don't see an immediate change in either quality or quantity of life, so it doesn't make sense to use. So you tend to see other cost-benefit analysis or cost-consequence analysis depending upon what the research question is. And I guess in a lot of the VCSFE sector, voluntary charity, social enterprise, and faith-based organizations, you see a lot of return on investment. So that's what's commonly done because of the fact that you don't have comparison groups necessarily.
And do people argue over what's best? Like, do different schools of analysis say you should be doing this or you should be doing that, or is it context dependent?
I think it's context dependent because I guess that one of these things is that the philosophy behind all these goes back to Rawls, who was a philosopher, when was he? I'd say the 1950s-ish, I could be completely wrong, but maybe, and so it's welfarism is the ideas behind it. So all of them are based upon the same kind of theoretical framework around welfarism, and then there's extra welfarism, kind of, which relates to how resources are allocated. So saying, you know, based upon societal preference and all that. So they all have this same underlying theory. So in that sense, there's not much argument about it because the theory is the same. Okay, so the hardest bit really, even when doing it, is collecting the costs. And thinking about what costs you need to include. So, first thing you need to do is to identify the resources that will be used and how you think about costing them. And this it takes months to do it, to even think about it. So say you had, you know, at a community centre, you had a programme, like the toddler and baby groups. You know, if you serve juice and cookies, you'd have to think about the price, well, of the juice and cookies, which I guess is obvious, but also of the lights. You know, if you have a fridge to store the juice or milk, you know, stocking the changing rooms, all these sort of things in practice really should go into the economic valuation. So you have the costs to kind of the organisation of running it, as well as depending, we'll get into perspectives, the costs as well as the people who attend. So if people take the bus, you know, if they took a taxi, I guess if you walk, technically you don't really have costs associated with walking. But if you're being really pedantic, if you walked and took a pram, you couldn't fit in the day cost of having the pram. So all these things really need to go into the economic evaluation. Even if you had volunteer helpers, there's the cost of their time, so that's usually based on on average, if they work and they took a day, you know, if they work 4 days a week, you do it based upon that, but if they don't work, then you do it based just upon the minimum wage rate at that time. So all of those things, if you're going to be doing an economic evaluation, need to go in there. So that's what makes it very time consuming to get all the cost data.
So we're basically looking at a core cost. You've got your core costs on it, and then you've got the cost of actually running the scheme. But you've always got like heating, electric.
Yeah, so that all goes into
so
that.
Becomes part of your core costs.
Yeah.
Yeah.
And then you have kind of the additional costs specifically related to the programme. And then if you think, depending on what it is and what impact it has on people, so you'd think as well, for some things, because I wouldn't necessarily it would be hard to make a case, but I was just thinking, like, if you go to these groups, you might talk about baby's health, so you might then say, oh, you know, my baby's been unwell, but someone might say, oh, try this, so then there'd be less usage of A&E potentially, but that is a bit of a stretch thinking. So those would be other things that you'd want to kind of think about if these programs, or kind of, you know, with the LGBT stuff, that if it reduced, say, self-harm, if people felt more part of a community or something like that, then that would also have knock-on effects to health. Or, as I mentioned, crime, so you can think of costs to they call it the Ministry of Justice, but the police. So that would all have to go in there. And that relates to what was the other workshop that I did, was on the quantitative method. So it goes to kind of the theory of change and thinking about all the kind of mechanisms of work, of how the intervention changes people's behaviour or people's outcomes. So there's a lot that then kind of goes into that. And then as well, which is hard, is to assign a monetary value to resource use. So the obvious ones, you can assign a monetary value to things like heating, transport. But then if you're looking at, say, potentially, changes in outcomes or health service usage, that is harder, but there are data sets that have that. And I think, and as well, I briefly mentioned this, is perspectives. So in economic evaluations, you usually take perspective of, so you can be clear about what costs you're going to include. So you have, well, the patient is more the individual, so it could be a caregiver, their family, so that would just be looking at things like person's travel time, if you're looking at that. So you have the NHS, so that would be looking at health costs. You could also have employers, if you're looking at kind of back to work programs, and society, so that's things if you're looking at kind of reductions in crime and everything like that, that would be taking a societal perspective. Or if they're, say, gardening club looking at environmental benefits, that would be societal perspective. And I guess before you start, if you were to do an economic evaluation, it's important to know what perspective that you want to take and justify it, because then that helps you collect the right types of costs. I'm going to say that for every type of economic evaluation except the social return on investment and the cost consequence, for both of those, since it's kind of, you're not making a value judgment, you don't have a perspective in those. You just kind of collect all the relevant costs, so that's slightly different. And then it's also useful to think about costs in terms of direct costs and indirect costs.
Excuse me, I'm so sorry, you've moved on to the next slide, but a question just comes to me on the last one, if that's okay, sorry.
Yes, no.
So, you said about a range of viewpoints being, for that one, thank you, for the perspective costs. In any kind of writing up analysis, applying for funding, you're showing that you've done the health economic evaluation, what tool you'll use or whatever. Do you need to demonstrate that you've considered all of those perspectives, or do you just have to pick the one that's most favourable? Do you just have to show that you've picked one?
You just have to pick one. And I guess it's...
Is that a silly question? Sorry, I'm not sure.
No,
I just wondered if you would need to evidence that you've engaged with different perspectives to sort of, show that you've considered the implications of favouring one perspective over another. So
yes, you do. I think you would need to justify why the perspective has been chosen.
Okay.
Because I was just thinking of a funding bid that I put in recently, and it's come back to the second stage, and we hadn't put a perspective in because of word count, so it was one of the things that was cut, and that was one of the things that they did come back with, saying, well, what perspective are you taking?
Yeah.
So I think it is important to think about it before, and that will be guided, I think, by the intervention. So if it was something, a clinical trial, say, for, I was going to say, I've only been involved in very few clinical trials, but it was one that was around antimicrobial resistance. So it was comparing, for urinary tract infection, women with recurrent urinary tract infections, it was looking at giving them an antiseptic rather than antibiotic. So therefore, for that one, it was taking a societal perspective, because it would be say that from not increasing kind of antimicrobial resistance, that there'd be knock-on costs to society. So that's kind of what you think of, who is it going to affect? Whereas if you're looking at something, immunotherapy for cancer patients, like a new type of immunotherapy, where it would basically have only a direct effect on the patient and the patient's family, then you wouldn't need to necessarily take a societal perspective. But if there's going to be an impact on other people, that's where the safe bet is just to take a societal perspective. So I'd say for most things that you'd probably be involved in, it would be a societal perspective.
Perfect, thank you.
Can I ask a follow-up question? You've
Yeah.
kind of already answered it, but I just wanted to ask a bit more. So is it always one perspective that's chosen? It's never a dual... So my question is around how easy is it to, or how possible is it, do you think, to truly disengage one perspective from all others? Because I'm quite interested in the intersectionality of systems theory and complexity theory, how nothing is really individual. Everything, to my mind anyway, the way I view the world, impacts something else. For example, you just said in that example you gave you know, if it affects the individual and their family. So that is a broader impact, you know.
Yeah.
So I suppose that's my question.
Yeah, so I guess this sort of thing, the societal perspective means you take kind of, you know, the cost across a wide range of things. Whereas if it was, you know, a specific treatment, yes, so you would get the cost for the individual and their family, so
Yeah.
carers is quite important. But, and there probably are costs to society, but it's just saying that the main costs occur to this
Yeah.
bit.
Okay. Yeah, that makes sense. Sorry.
No, it's a good question though.
My
So
complexity.
you can go on ad infinitum, you know, one thing
Yeah.
always compounds and brings it onto
Well,
another.
that's my perspective.
So you've
yeah.
got to look at
It's
the
interesting.
main perspective that you want to affect.
Yeah, yeah.
And then I suppose you can evaluate the others afterwards, but the main thing is,
But then is that what we say is the corrective? Is that then opportunity cost then to not, you know, to say we're centering just on this specific individual perspective and therefore we're losing the complexity and everything that could be found in the wider society?
Well, yes and no. So yes, in the fact that because it would take ages, and it would also be hard to make the case that there is a direct effect of the intervention on those things. So it's kind of pragmatic in saying that we can say there's a direct, because even when you look at societal costs, that you could look at, say, a lot of things I do relate to children. So, you know, you might be look at the education sector or the criminal justice sector, because those are kind of, but you wouldn't necessarily look at, you know, transport, you know,
Yeah.
something if it's not relevant. So it's kind of, that's where it's really important to think about the mechanisms of how the intervention works, who are going to be the key stakeholders. So it's, I don't have on this side, I can add it from the other one that we did. It's kind of the MRC complex intervention theory. So you have to think about, you